Thinking about the early signs of a depressive episode, we would expect to potentially see a range of different symptoms, which will be different from person to person. Typically, a depressive episode will start with a change in mood, with the mood being lower or more sad. We might also notice changes in sleep, people needing to sleep more potentially, or potentially struggling with getting off to sleep, or waking up earlier in the morning. Associated with that, people might feel more tired than usual. They might be struggling to do their day-to-day things and finding that their energy levels are starting to drop off compared to normal. So that might be that they stop going out to meet up with friends. They might not get as many tasks done at work. They might be struggling to do things at home. People might also notice a decrease in their appetite. So they might start eating less at meal times. They might skip a meal. They might not have a snack when they usually would. Early on, that wouldn't lead to weight loss, but that would be an important thing. If we noticed that somebody's weight had decreased, then we'd be thinking, why has that happened? People might also struggle with concentration, with focus, and find that they're not as able to get on with the tasks. They have the motivation to do so potentially, but they might not actually be able to sit down and focus on that thing. And again, more rarely, but an important factor to think about is the presence of distressing thoughts or unpleasant thoughts. People might have thoughts of not wanting to be around anymore, or not wanting to be alive, or wanting to harm themselves, wanting to escape, potentially. And again, if those thoughts were starting to emerge, that would be a particularly important point to think, okay, something isn't quite right here. We need to seek support. So in summary, there's a wide range of different things that can happen with a depressive episode. The key factor being mood, of course, and early detection of these things can really help with preventing a prolonged and troubling episode of illness.